I am alive because of community. When I was diagnosed in Jakarta in 2010, I had CD4 count of 20. Staff at my NGO took me to doctors. They took turns looking after me. They were with me as I took my first step after starting treatment. They held my hand. They made me laugh. 13 years later, I not only have undetectable viral load, but the confidence to embrace life fully and proudly as a gay man living with HIV. I've been lucky, but community support should not be left to luck. Far too many people showing up for HIV services remain a lonely act of courage. The report tells us that treatment services are still missing 9.2 million people. It is also tell us that among surveyed countries, 59% of people had discriminatory attitude towards people living with HIV. We know that people living with HIV who anticipate higher level of stigma are more than twice as likely to delay enrollment in care until they are very ill. We also know that the path that end AIDS require the engagement of people living with HIV and key population, men who have sex with men, people who use drugs, sex workers, transgender people. We need health service to work in partnership with civil society to address the realities of people's lives and break down the barriers blocking them from care and support. The countries in our regions that are closest to achieving the 95 target have embraced the power of communities to reach these groups and supercharge results. In Cambodia, inclusion of community in the design of implementation of HIV service has been critical to increase the number of people who access PrEP. This has widened the reach of HIV prevention service and informed regular improvement of HIV service through community-led monitoring. In Thailand, HIV prevention, testing, and treatment services are covered by the Universal Health Coverage System, and certified community-led organizations are reimbursed for providing services. The success of HIV programs everywhere is reliant on the voice and the reach of communities, including people living with HIV, key population peer groups, and other civil society organizations. They help drive demand for services. They mobilize political leadership. They serve people not reached by formal health systems. They monitor the quality of HIV services and co-create solutions with stakeholders. And they help create an enabling environment that promote equitable access. Our government made commitment to ensure the inclusion of people living with HIV and communities most affected by HIV in AIDS response planning, implementation, and evaluation, strengthening and scale up community and peer-led intervention. They pledge to continue investing in community-led service delivery, including through social contracting to support community-led monitoring and research. It's time to translate this promise into action everywhere. In Asia Pacific, APM Plus, with support from the global network of people living with HIV and UNAIDS, has been working together to eliminate all from HIV-related stigma and discrimination. Community leadership is central to all this evidence-based strategy. On behalf of community everywhere, I say to political leaders, the time has come to stop thinking of our work as optional or as volunteerism. Community action is essential work and it should be compensated and financed as such. As we embark on the last mile of our journey toward ending AIDS, the helping hands of our community must be recognized, respected, and resourced.